Okay, so today we're going to tackle something that might sound a little intimidating at first glance.
Oh.
Yeah, medical imaging,
Ah.
but specifically CT coronary angiograms.
Okay.
But don't worry, we're not going to go all like med school lecture
Oh,
on you.
wow.
We're just going to kind of explore what makes a great CT scan for, looking at those super important coronary arteries. I mean, if you ever needed this type of scan, you'd want to know that
Absolutely.
you're getting like the best possible image, right?
100%. Yeah, the clarity of these scans can make a huge difference,
Yeah.
in the diagnosis and in the treatment plan.
Right. And so for this deep dive, we're looking at a technical document all about optimal configurations for CT angiograms.
Okay.
And fun fact to kick things off,
Okay.
some of these super advanced scanners can actually capture your entire heart
Wow.
in a single heartbeat.
Really?
It's like high-speed photography, but for your heart.
That is remarkable how far imaging technology has come.
Right.
Yeah, this document basically lays out like a wish list
Okay.
for achieving the highest quality CT angiogram.
Okay.
And one of the first things they emphasize is slice count.
Slice count.
Yeah, think of it like the resolution
Right.
of a digital camera,
Okay, got it.
but for your heart.
So more slices
Our slices.
means a sharper image,
Sharper image, exactly.
especially for those tiny little intricate arteries.
Especially those. Yeah.
And the document actually recommends at least 64 slices,
At least.
but ideally 128 or more.
Even more the better.
So why is that so important? Why do we need so many slices?
Well, you got to think about it. The heart is constantly in motion.
Oh, right. Yeah.
So those higher slice counts, they allow us to capture those delicate arteries with incredible precision.
Okay.
And it minimizes any blur
Okay.
that might be caused by that motion.
That makes a lot of sense because, I mean,
You're right.
capturing a clear image of a beating heart,
Right.
I mean,
It's a
it's
challenge.
got to be incredibly challenging.
It is. And that's where temporal resolution comes in.
Okay.
It basically describes how quickly the scanner
Uh-huh.
can actually capture the image.
Right.
And this is where dual source CT scanners
Okay.
really shine.
Dual source.
They use 2 X-ray sources and 2 detectors,
Oh, wow.
which effectively doubles the scan speed.
Interesting.
This is especially helpful for patients who might have faster heart rates
Okay.
or irregular heartbeats.
So it's almost like having two cameras
Yeah.
taking pictures at the same time.
Yes.
So you don't miss anything.
Precisely.
Wow.
And then the document also goes on
Gotcha.
to highlight spatial resolution.
Okay.
This refers to the level of detail we can see, and they're talking submillimeter precision.
Wow. So we're talking tiny.
Tiny, tiny. Imagine trying to find a tiny crack
Oh, gosh.
in a delicate piece of china.
Yeah.
You need the right tools.
Right. The right magnifying glass
Exactly.
to even see it.
To even detect it.
And in this case, we need that to be able to accurately diagnose
Right.
any blockages or anything like that.
Any blockages in those coronary arteries? Yeah, absolutely.
And it can't just be about the power of the scanner.
Oh, definitely not.
It's also about the timing.
Timing is crucial, and that's where ECG gating comes in.
Okay.
This technique synchronizes the scan with the patient's heartbeat.
Uh-huh.
So essentially, we're making sure we're capturing the images
Yeah.
at the most stable point
Okay.
in the heart's cycle.
So it's like having a conductor leading an orchestra to make sure
Perfect timing.
Yeah, perfect timing.
Yes.
Wow.
And to make sure we capture the whole performance.
Okay.
The document also talks about Z-axis coverage.
Z-axis coverage.
Yeah. Wider coverage means capturing the whole heart
Okay.
in one go.
So fewer scans.
Fewer scans, less time in the scanner.
It's good for everyone.
Always a good thing.
Less radiation.
Exactly. And speaking of patient comfort,
Uh-huh.
the document really stresses radiation dose optimization.
Okay, that's a big one for a lot of people,
It is a big concern.
myself included.
Right. So they talk about things like tube current modulation,
Okay.
which adjusts the X-ray intensity based on the patient's size
Okay.
and the area being scanned.
Got it.
And then they also use iterative reconstruction,
Okay.
which is this sophisticated software
Uh-huh.
that essentially cleans up the image,
Wow.
allowing for clearer pictures with less radiation.
That's good.
Yeah, lower radiation dose is always the goal.
Absolutely. And then, of course, the
Fine.
contrast dye.
Yes.
Can't forget about that.
The contrast agent helps to really highlight
Yeah.
those arteries on the scan.
It makes them stand out.
Makes them stand out so you can see them clearly.
So it's like having the best camera,
Yes.
the best lighting,
Yes.
and the best editing software,
all working together.
all to give us the clearest possible picture.
The most detailed picture of your heart.
That's amazing.
It really highlights how technology is constantly evolving to improve healthcare and diagnostics.
Yeah, it's incredible how all these pieces come together to create such a powerful tool,
It is. It's fascinating.
for diagnosing and for treatment planning.
Absolutely.
When it comes to CT coronary angiograms,
Yeah.
it's clear that technology matters.
Technology matters, and I think, knowing what goes into a high-quality scan
Right.
really empowers you
Uh-huh.
to ask informed questions.
Yes.
And to make the best decisions for your health.
Exactly.
So I encourage everyone listening, think about what questions you would ask your doctor
Yeah,
to make sure you are receiving the best possible care.
absolutely.
Knowledge is power,
Knowledge is power.
especially when it comes to your health.
Couldn't agree more.